Is there another option besides fusion?
Yes, it's called Vertebral Body Tethering, or VBT.
VBT is a surgery that helps guide the spine's growth. To do this, doctors use tiny screws, a drill, and a flexible cord. First, the screws are placed along one side of the spine. Next, the cord is carefully threaded through each screw anchor. Then the surgeon gently tightens the cord. This gives the spine some straightening right away. And as the child grows, the curve improves even more. That's why VBT works best for younger patients with growth left. It also helps most when the curve is still flexible. After surgery, recovery usually takes weeks, not months. Before long, most kids are back to sports and active play. It's not for everyone, but it is an option.
Next up, growing rods, magic and vector.